third DNS test. So we started with 3-month model extension test. We did 4-point rock test, and this is our third test that we can see what the shoulder blade's doing. We always look at the loading of the feet. So just like in the hand, if we don't have the right ideal stabilization in the hand, in the foot, if we don't have the right stabilization at the hip, they will overload the 5th metatarsal. So we want to be sure we have equal loading between the 1st and 5th metatarsal. And then from a testing standpoint, what I usually do now is we're gonna add load to the system. So Jess, let me have you just lift up your right foot a millimeter.
Is that not a millimeter?
It's fine. So then here we want to see, do we see any excessive Trendelenburg? Do we see like any dipping or rotation in the low back? I mean, she's doing pretty well here. Let me have you with your left foot now. So we see whether or not we see inclination of the pelvis this way. The other thing we want to see is if they have to do a trochanteric shift, a Trendelenburg to do that. So if you don't use the right muscles around your hip joint, you don't have a choice. Whether you're in this test, whether you're in a single leg squat, or whether you're in a gait eval, if your compensation pattern is to use your TFL, there's no mechanical blockage in the coronal plane. You don't have a choice. You have to shift too much because you have the wrong muscles on around the hip joint. So in the most common strategy, kind of the protective pattern around the hip joint, is too much activity on the TFL, not enough recruitment out of glute max, glute medius, and the external rotators. Or you see too much recruitment out of the external rotators, not enough eccentric activity out of the glute. Again, if you just look at the glute, if you can imagine, we just want to see like kind of like a size 4 soccer ball here. Like we should see a perfect sphere here. But when people don't have great glute activation, you see like the divots in the back of the glutes, which is it's real common, even a lot of people in here. Okay, so now that's for the lower extremity. This is also an amazing test for the upper extremity. So we want to see if they're going to do what I call an upper body Trendelenburg here. So let me have you lift your right hand up just an inch. Not so easy on this one, hotshot, huh?
Not so easy.
So there's really nowhere to hide on this. That's why I like, so if we're just looking at the shoulder blade, the 4-point rock test is a really good qualitative test. This tells us like more of like the function. So are they able to do it without shifting, yes or no? Let's try the other side. And hold. You can just lift it up barely an inch.
I'm not getting that.
And now back down. And now let's do your right hand again. We always watch the whole body through the reaction. So see how she has to shift to pull this off. What does that tell me? It tells me that she's not 100% in her ability to stabilize here. Whereas down here, she did a pretty good job. Now we can even add load on both sides. So let me have you go right hand up, left foot up. And now back down. And now again. Bears also, from an exercise standpoint, it's a really good way to activate deep neck flexors when we get to the exercise part of it. Okay, so let's just kind of review. So the first thing is we get them in the right position. So let me have you come up on your toes there, Jess. And then here we just start noticing things. For the runner, what you'll see a lot of times in the anteverted hip, from this position here, you're going to see internal rotation of the limbs like this. It's also a good place to see how well they're able to upright their spine, position of the shoulder blade, position of the head, intra-abdominal pressure, everything you were just taught as far as the hand and the 4-point rock test. Okay, come up and then I'm almost done with you. And then we simply just unload a limb. So let me have you lift up your right foot. Nice work. And now other side. Then we can do the arm. So it is, I use it a ton for assessment. I use it for movement preparation a lot. And I also use it in rehab and treatment. So I think it's really good for movement preparation because it's not so fatiguing and it's such a great overall body activation. So like a lot of times, like before you start pitching or whatever, like a half hour before, I think this would be one of the things that we would do with them just to get everything activated. All right, let's go. Let's party.